Vertigo is a symptom rather than a disease itself, and it can be associated with a variety of conditions. It's essentially a sensation of feeling off balance, typically described as a spinning sensation. While vertigo can feel debilitating, it's usually treatable, most commonly with certain head maneuvers and addressing the underlying condition causing vertigo. If you're experiencing vertigo, it's important to see a healthcare professional for diagnosis and appropriate treatment. Comorbidity refers to the presence of one or more additional diseases or disorders co-occurring with a primary disease or disorder. In other words, it's the simultaneous presence of two or more chronic diseases or conditions in a patient. Below are some conditions that may cause vertigo and can be considered as comorbidities. Number 1. Cardiovascular disease. Cardiovascular diseases, encompassing various disorders of the heart and blood vessels, can sometimes result in vertigo due to potential impact on blood supply to the balance centers of the brain or inner ear. Arrhythmias, which involve heart rhythm irregularities, can lead to reduced brain blood flow and consequent symptoms such as dizziness, vertigo, fainting, and even chest discomfort or breathlessness. Orthostatic hypotension, a type of low blood pressure experienced when standing up from sitting or lying down, could also induce vertigo. In more serious cases like carotid artery disease, where the arteries supplying blood to the brain become narrowed or blocked, transient vertigo symptoms may arise. Other conditions increasing stroke risk, such as hypertension, coronary artery disease, and heart failure, may indirectly increase vertigo risk. Lastly, atherosclerosis, characterized by plaque buildup in the arteries, can contribute to vertigo symptoms due to reduced blood flow to the brain. Individuals with these conditions need to manage their cardiovascular health and monitor symptoms under professional guidance. Lifestyle modifications including regular exercise, a healthy diet, and avoiding smoking, paired with appropriate medications, can assist in controlling cardiovascular diseases and diminishing the risk of vertigo and other complications. Point 2. Number 2. Acoustic neuroma. Acoustic neuroma, or vestibular schwannoma, is a benign and typically slow-growing tumor that originates in the main nerve connecting the inner ear to the brain. This nerve has crucial influences on both balance and hearing. When an acoustic neuroma applies pressure to this nerve, it can lead to symptoms like hearing loss, tinnitus, ringing in the ear, balance problems, and vertigo. Although acoustic neuromas are rare and their cause largely unknown, about 5% of cases are linked to a genetic disorder named neurofibromatosis type 2. Interestingly, vertigo is more frequently seen as a symptom of early-stage, smaller tumors. Larger tumors can cause more distinct or severe symptoms, and it can cause severe neurological symptoms like headaches, mental confusion, or even unconsciousness. There are several treatment options available for acoustic neuromas, including regular monitoring, radiation therapy, and surgical removal. The choice of treatment is influenced by factors like the size and location of the tumor, the patient's overall health, and the severity of the tumor's symptoms. Even though preventing acoustic neuromas is not possible, the risk of hearing loss can be significantly minimized with regular checkups and early treatment before the tumor can cause substantial nerve damage. Number 3. Migraines. Migraines are a type of headache characterized by intense, debilitating pain, often accompanied by nausea, vomiting, and sensitivity to light and sound. They are often preceded by sensory warning symptoms, aura, such as flashes of light, blind spots, or tingling in your arm or leg. Some people may experience vertigo and dizziness before or during migraines. Migraines associated with vertigo are often referred to as vestibular migraines or migrainous vertigo. The International Headache Society defines vestibular migraine as a condition characterized by episodes of moderate or severe vertigo, imbalance, and unsteadiness lasting minutes to hours, often accompanied by migrainous symptoms. The exact cause of vestibular migraines is not known. Like other types of migraines, they are thought to be related to changes in nerve signaling pathways and blood flow in the brain. Certain triggers like stress, certain foods, alcohol, hormonal changes, lack of sleep, and others may provoke an episode. Treatment for vestibular migraines usually involves strategies to control the migraines. Preventive medications like beta blockers, tricyclic antidepressants, certain types of anticonvulsants, and calcium channel blockers are often used. Lifestyle changes, like regular exercise, a healthy diet, good sleep hygiene, and avoiding known triggers, can also help manage the frequency and severity of migraines. It's worth noting that if you experience vertigo along with migraines, it's important to seek medical advice. While the condition is not life-threatening, it can impact your quality of life and increase the risk of falls. Your healthcare provider can help determine the most effective treatment strategies based on your specific symptoms and overall health. Number 4. Stroke or transient ischemic attack, TIA. Stroke and transient ischemic attack, often referred to as a mini-stroke, are serious conditions that can cause vertigo. A stroke is a critical medical situation where the blood supply to a part of your brain is blocked or reduced, depriving the brain tissue of oxygen and nutrients, and leading to brain cell death within minutes. Vertigo can be an early sign of a stroke, particularly if it's accompanied by other neurological symptoms, including sudden numbness or weakness on one side of the body, confusion, speech difficulties, visual disturbances, or severe, unexplained headaches. Meanwhile, a TIA resembles a stroke, producing similar symptoms but without causing permanent damage. This condition is characterized by a brief decrease in blood supply to part of your brain, often lasting no more than 5 minutes. Vertigo can also be a symptom of a TIA, usually presenting alongside other stroke-like symptoms. Both of these conditions require immediate medical intervention. Risk factors such as high blood pressure, smoking, diabetes, high cholesterol, cardiovascular disease, advancing age, and family history of stroke or TIA can increase the likelihood of these events. Proper management of these risk factors can significantly reduce the risk of experiencing a stroke or TIA. Number 5. Ménière's disease. Ménière's disease is a chronic disorder of the inner ear that typically affects only one ear and can lead to recurrent episodes of vertigo and hearing loss. The exact cause of Ménière's disease is still unknown, but it's believed to be associated with an imbalance in the fluid in the inner ear due to factors like improper fluid drainage, abnormal immune responses, allergies, or viral infections. This disease is characterized by symptoms such as repeated instances of vertigo, hearing loss, tinnitus, ringing or buzzing noise in the ear, and a sense of fullness or pressure in the ear. The frequency, duration, and severity of these episodes can vary greatly from person to person. Diagnosing Ménière's disease typically involves a physical examination, hearing tests, balance tests, and occasionally, imaging tests like MRI, to rule out other conditions. The condition can be managed through a combination of medication, lifestyle changes, and in severe cases, surgery. Medication may be used to control vertigo and reduce fluid buildup in the inner ear. Lifestyle modifications, like reducing salt intake and managing stress, can also be beneficial. Although Ménière's disease is chronic and the hearing loss might progress over time, with appropriate treatment, the severity and frequency of episodes can be effectively managed. If you've enjoyed this video and helped you learn more about vertigo, please be sure to subscribe to our channel and click the notification bell so that each week we release a brand new, life-saving video, you'll get notified right away.